Hi, uh, I'm Cindy Perlin from the Alternative Pain Treatment Directory, and this is a Facebook Live on Hope and Help for Intractable Chronic Pain. I'm the founder and CEO of the Alternative Pain Treatment Directory, and myself a survivor of chronic pain. And I'm here with Dr. Traci Patterson. She is a complex regional pain syndrome survivor, also a trained MD, and runs a program in Boise, Idaho on holistic centered treatment. And she's here to tell her story and to talk about what really helps with intractable pain. So thank you, Dr. Patterson, for being with us. Welcome.
Absolutely. Thank you for having me today. So go ahead.
So can you start by talking about what happened to you, how your pain started, and what your journey was like? It's a pretty compelling story.
Yeah, absolutely. First and foremost, today is actually CRPS Awareness Day, and the month is CRPS Awareness Month. So I'm going to throw that out there at the very beginning.
Oh, I didn't even know that.
It is. The first Monday in November is always CRPS Awareness Day. So I think the more we can bring attention to that, the better off we are. But yeah, let me jump in and tell people a little bit about who I am and what I do. But more importantly, my story. And I think that kind of leads us into the next parts of this Q&A. For myself, prior to CRPS, I was executive on the healthcare side, a mom, a wife, very active, still played recreational softball, did volunteer work, etc. And I had sprained my ankle and it just wasn't healing right. And that was like the first domino, but that wasn't the CRPS domino. And unfortunately, I was sent by my primary to a podiatrist. And originally he said everything from, hey, it's plantar fasciitis to it's just a severe sprain. And at that point, all they were doing is trying to manage it with physical therapy. They kept going back to this plantar fasciitis, and it didn't make sense to me because that's not where my pain was. But, I talked to some colleagues and went back to my primary care, and she's like, you know what, if that's the possibility, it's an easy surgery. So did that surgery. It didn't help. And I think a lot of people go down that road of, the red herring type of a thing. And fast forward, they finally did an MRI, did additional x-rays, additional testing through several months. And then I was told I had an accessory navicular. Well, all that is an extra bone in your foot. Well, it didn't make a lot of sense to me because it's been there my whole life and it's never, ever been a problem. But they kept saying it's way too big. And they thought that that's what was causing the issues. So again, I did my homework. Talked to my primary, talked to a couple other people that I knew in the medical field and said, what are your thoughts on this? What about the surgery? And I was told it should be a cakewalk surgery. So I'm like, okay, if that's going to be the thing that helps me move forward, then let's do it. And unfortunately, that was the first step in a very slippery slope that led to CRPS. For me, unfortunately, he did get it over his head, the podiatrist. He made the incision in the wrong spot, which meant he cut into the tibial nerves. He ruptured the posterior tibial tendon, and everybody has amnesia. We have no idea how that happened. In addition to that, he managed to get down at the bottom of my foot and he nicked what they call a lateral plantar nerve, which goes across the very bottom of your foot. And he shouldn't even been there. So needless to say, all of this is happening during this surgery. And I wake up in recovery to pain that I've never felt before in my life. And, just to take a step back from that, prior to that, from elementary to early college, I was a catcher in competitive fast pitch softball. So I know what it's like to have rotator cuff surgeries. I know what it was like to play a whole tournament on a broken foot before. I had my son by that point. I knew what childbirth was like. When I woke up in recovery after that surgery, it was like a pain that I had never I just can't even put words to it. And I think anybody that's lived with CRPS or similar diagnosis know exactly what I'm talking about. And I just remember, the nurse coming over and saying, where's your pain level? And I'm like off the charts. The next thing I know, I'm out again because they're administering so much medication. But then I was also the last patient in post-op at an outpatient surgery center. What I didn't know is my doctor went on vacation. He wasn't even there. He had no idea. So he took off on vacation, left me in recovery with the nurses. And they're just trying to get me out of there because it's outpatient. So they gave me as many meds as they could to get me out the door. And then I get home and my pain levels it just felt like my whole foot and my ankle was literally on fire. And it was a pain that I could not wrap my head around. And my mother-in-law used to be in the medical field too. And so I was calling her going, what do I do? And we kept trying to call the surgeon and we kept getting the service. Then we were told he was on vacation. Well, I wasn't told that before the surgery. So then all of a sudden I've got his partner on the phone with me who I've never met before. And, up to that point in life, I had had so many orthopedic surgeries, it wasn't funny. And his partner's on the phone with me asking me to unwrap a fresh surgical site just hours after the surgery to look at it. And I'm like, are you kidding me? So it was lunacy. By the next day, tried to call back to his office again. Could not even get a return phone call from his partner. So my mother-in-law took me to the ER because we didn't know what else to do. In the ER, they were upset and ticked off is the nicest words that I can use, the fact that I was a post-surgical patient ending up in the ER. So they didn't know if it was an allergic reaction because it was bright red and it was a mess. So, we ended up the following business day in the partner's office, and he was doing swabs for everything from a staph infection, etc. They just didn't know what to do with me. And so fast forward a little bit. And even after that surgery, I was left with my little toe in continual spasms. So we have CRPS now. Well, what I now know is CRPS. At the time, we didn't know what that was. But I happened to have a neurology appointment within a week or so after that surgery. And my neurologist was amazing. She looked at my foot and she's like, Traci, this could be something called CRPS. And I'm like, what the heck is that? And she's like, don't look it up. I'm not diagnosing you. I'm hoping it's just really, really bad post-surgical pain. Let's keep an eye on it. And it just kept getting worse and worse. So she finally had another follow-up appointment with my neurologist. She sent me to pain management and made the phone calls to get me in within weeks. So my journey, unlike so many other patients, is unusual because I was diagnosed early. Mm-hmm. And so many other patients that I talk to and I see that have CRPS, they can see 20, 50, 100 plus doctors before they get a diagnosis because there's not a diagnostic test for CRPS. So fast forward to that pain management doctor appointment, and I give him credit. He was thorough. And back then, again, we're going back 18 years. So this was a long time ago. And he was thorough. I brought in my medical records and he just sat him down and he goes, you know what? I just want to hear it from you. What's going on? And he was very careful. He did a full exam on my foot. But the same thing is true now that was true 18 years ago. And that's sad, which is we don't have a diagnostic test for CRPS. They go off of Budapest criteria, signs and symptoms. So based upon pain levels that were off the Richter scale, the fact that he couldn't touch my foot because allergy and allodynia, that sensitivity to touch, it was bright red. So we had the coloration changes and sometimes it'd go molten bluish purple color. Everything was there. And so he basically said, hey, Traci, I've got good news and I've got bad news. And I'm at that doctor's appointment by myself. And I'm like, well, give me the good news first. And he goes, well, we caught this early. We caught it in the first 6 months. I'm like, we caught what early? So, he basically threw out CRPS. And I'm like, what is CRPS? Like, I've never heard of this before. What is CRPS? And he goes, that's the bad news. He goes, you have something that's a rare and curable disease. And because we caught it early, I think if we treat it aggressively, that I can get you into remission very quickly. He had nothing to give me, no information. The internet was brand new. I'm going to make myself sound like a dinosaur right now. Go back 18 years, the internet was brand new. We didn't have Facebook. We didn't have Instagram. We didn't have TikTok. We didn't have all the social media platforms. And he's telling me to go home and look it up. So I'm driving home by myself and my head is spinning. I have a follow-up appointment with him in 2 weeks. And I'm like, a rare incurable disease. How is this possible? Like, what does that mean to me? So that night, not only did I start looking it up, and it was horrific, but I reached out to 2 former colleagues, and they reached out to a couple other physicians for me. And my question to them was, what is CRPS? And the first response I got back from one physician was, please tell me it's not you. And that's not something you want to hear.
Right.
Not something that you want to have past your ears at that point in time. And my response was, yeah, it is me. So now what? What do we do? How do we fix this? And everybody that I talked to outside of my primary care and pain management neurologist that knew me personally just said, Traci, we're so sorry. And I'm like, am I dying? Like, what?
Yeah.
What in the hay bale does this mean to me? Like, what the heck? And my head just kept spinning. I had a really close friend of mine say, you know what? I'm so sorry. Life as you know it just ended. And I'm like, whoa, wait a minute. Again, what does this mean? So, it was a mess. And the problem that I had, and I think a lot of patients run into, is the podiatric surgeon that did that surgery messed up. And I'll clarify, just because you get CRPS following a surgery does not mean that there was a mistake during your surgery. For me, there were many mistakes made. And the problem is I needed some follow-up surgeries because he left a posterior tibial tendon ruptured, which means that's what helps propel you forward to walk. So even above and beyond CRPS, if I didn't do a reconstructive surgery, I wouldn't be walking. So for me, I started going through the steps of, okay, I can't go back to this surgeon. I've got to go find another way. So I found like the top orthopedic foot and ankle surgeon, brought in the medical records, made the appointment. He walked in and he was also a professor for orthopedic foot and ankle surgery at UCSD. He was the man I needed. And he walked in after I waited over a month to get that appointment. And he just shook his head. He goes, I looked at your records. I'm not even going to examine you. Yeah, you need a surgery. I'm not the man for the job. There are too many flags flying. So because there was malpractice on the table, even though I wasn't pursuing it at that point in time, nobody wanted to touch my case with a 10-foot pole. And the problem is, I think a lot of patients run into that. And that left me thinking, okay, wait a minute, I'm the patient and I just need help. But yet I couldn't get the help that I needed. And I've heard that story for so many other people. So during this time, I continued to see my neurologist. I had to do my mandatory post-op visits with the podiatric surgeon who actually caused the mess, because nobody else would pick up those pieces either. So we started with local blocks and regional blocks in my foot and ankle, and they couldn't figure out why they weren't working. My pain management doctor then started talking to me. I was doing physical therapy already, which just hurt so bad. That just caused flares with physical therapy. And then I was told, okay, we need to do lumbar sympathetic blocks because that can help jumpstart the whole system, and that can be the key to you getting into remission. Well, my body's weird, and I'm hearing this from a lot of CRPS patients. My body metabolizes medications differently, and I didn't realize it. So, we go in to do the lumbar sympathetic blocks. Plus, he had me on a boatload of meds by that point in time. And they don't do a general for lumbar sympathetic blocks. They put you either in a twilight or deep sedation. And I'm that weirdo that they gave me Versed in pre-op so that you're loopy and don't know what's going on. When they wheel you back to the OR, it doesn't work on me. So I'm in there having a full conversation with the nurses. I see the whole way back to the OR suite, and I'm positioning myself on the table, and everybody's looking at me like, why are you awake? Well, I don't know, just not working. So they tried to sedate me to do the lumbar sympathetic block, and they put in the medication so I couldn't wiggle around. But the problem is none of it worked. So I couldn't get their attention to let them know I was fully awake, fully with it, feeling everything that they were doing and hearing every conversation that was going on in that OR. And that's traumatic as a patient. When you're a patient going through that, that is not what you want. And, it's needless to say, got into post-op that day. And I am the strong when I do not cry. That's just not my personality. And I was bawling like a baby in post-op. And my pain management doc came in and he's like, "What? Everything went really great, Traci. What are you upset about?" I said, I could feel everything that was going on. And he didn't believe me. He did not believe me. And he's like, "Traci, there's no way. I know the meds that we pushed." So I started recanting conversations because they were talking about his girlfriend. And so when he started hearing me talking and basically telling him about the conversations, he was horrified. And he just looked at me and he goes, "I'll see you tomorrow in my office," because he didn't know what to say. So I met him the next day in his office and he's like, "Traci, I am so sorry. This has not happened before." And I could tell by the look on his face that he was actually telling the truth. And he's like, "We've got to do another block." And I said, "But it didn't help with my pain." And what they looked at as success, and they do still, is my foot warmed up. So even though I got zero pain relief, but because my foot warmed up, they looked at that block as successful. So he talked me into doing a second block. And he goes, "Traci, I promise you, I'll take control of the meds. I'll make sure that you're taken care of." And I trusted him. And we went into the second block, same nurses, same outpatient surgery center, same deal, Versed, wake the whole way back, get in the OR, positioning myself on the table. But this time he'd come around and he'd kind of like duck underneath and look at my face. And he's like, "Crud, you're still awake." And I'm like, "Yeah, I am." So the last thing I remember before passing out in the OR that day was him telling the OR nurse, the head nurse, to push more medications. She said she couldn't. And he said, "If you're not going to push them, step out." And that happened one more time with somebody else. So what I was told is that we ended up with myself, an OR tech, and my surgeon, my pain management doc in the OR. That was it. And he talked to me afterwards. He kept his word, but he also told me afterwards, he goes, "Traci, if something would have happened to you in there," he goes, "I would have lost my license." And that was scary. It was scary to hear that. And again, really didn't get pain relief, but because my foot warmed up again and there was some temperature regulation, they tried to tell me that it was successful again. So then we did a total of 13 lumbar sympathetic blocks. From the third one to the 13th one, they were all done with general anesthesia, which is unheard of. And unfortunately for me, they used too high of a dose of cortisone and steroids within those blocks, when they actually threw me into adrenal failure. And yeah, I've heard that from other patients too. So what they were trying to do was
talk about what adrenal failure is.
So basically your adrenals totally shut down. So the person who caught it, I happened to have had a neurology appointment 2 days after that block. And I went into my neurologist's office. I was white as a sheet. I had zero energy. I was puffed up like Pillsbury Doughboy. My body was just retaining fluids. I wasn't sleeping. I had no energy. In addition to CRPS, I literally felt like my body was shutting down. That's the best way I can describe it. And my neurologist took one look at me, didn't even examine me. And she's like, "Traci, you have two options. You either promise me, because the hospital was around the corner from her office, she goes, you either promise me that you are on your way there right now, or I'm calling the ambulance. And it was that bad. So I'm like, I promise you I'm going. And I called my mother-in-law. She was my fail-safe. So I called my mother-in-law, told her what was going on. She met me at the ER. They did a bunch of blood work and a few other tests in the ER. And they're like, you're in adrenal failure. Like, this is very, very serious, and was admitted on the spot. So I was fortunate that I did bounce back from adrenal failure, and not everybody is that fortunate. I mean, that's a pretty major thing. So I was hospitalized for several days, then found an endocrinologist. Between myself and my neurologist, she's my savior. And this endocrinologist, it was interesting because back then nobody talked about integrative or alternative medicine. But he looked at me and he goes, Traci, you're on so many meds. I don't want to add another one. He goes, let's go the natural route. Let's try some natural remedies. If your numbers don't start improving within a week, we'll go back to prescription meds. And we did that. And my adrenal started working again. And, that got my attention a little bit. Fast forward from there, we found a doctor out of Florida who said he was getting the majority of his CRPS patients into remission with hyperbaric. So I had my doctor call. My pain management doc was a warrior with me. I had the same pain management doc the whole way through, even with oopses and mistakes, because he changed how he did things and he learned. So he got the protocol from Florida, and he gave me a prescription for it. And he's like, Traci, insurance isn't going to cover this. And my response is, I didn't ask if they would. Like, I'm desperate. I don't care if they're going to cover or not. I've got to do something other than what we're doing right now. And by that point, with CRPS, again, one doctor prescribing, go back 18 years, I was on Dilaudid. I was on methadone. And this is all at one time. These are not separate times. Oral ketamine, Solendac, amitriptyline, Topamax, fentanyl patches, topicals, and there are probably 2 or 3 other meds in there that are just kind of escaping my mind right now. So I was maxed on meds by that point, and there really wasn't anything else that we could add to them. And to be honest with you, if I would have taken them as prescribed, I probably would have OD'd. And because I always had extra pills left because I was so afraid of them. And even with that many meds, I was still at an average pain level 8 out of 10. So we did 30 plus rounds of hyperbaric at a very reputable company in Newport Beach, California. I did nothing, absolutely nothing. And I was like, you've got to be kidding me. And in between that stuff, if friends came or family members came to me and said, hey, let's try this or let's try that. My mother-in-law was friends with a physician, and they had a company trying to sell her mud packs for pain. So she called me and said, hey, Traci, can you come in and be our guinea pig? You have more pain than any other patient I've ever seen in my life. Can you come be the guinea pig? And I'm like, is it going to cost me anything? No. Okay. It hurt like heck going on, and that's the understatement. And it hurt even worse coming off, and it did absolutely nothing for my pain. So if somebody told me to try something, I was willing to do it. I was the first one in line because I needed to do something to get my life back. When all of that failed, my doctors all said, hey, you know what? We can't do any more blocks with you. Your body's not tolerating them. And my response is, duh. So then they talked to doing a spinal cord stimulator trial, and everything in my gut, everything in my being said, do not do it. But at that point, and again, going back way back when, we were limited. And so I did the trial. I put it through its paces, and it seemed to help a little bit. So I'm like, well, maybe my gut's wrong. And they talked me into doing not just a regular spinal cord stimulator, but Medtronic with a paddle, not just 2 leads, a whole paddle. And my pain management doc was afraid enough of me and my body and how it responded. He sent me to a neurosurgeon. He did not, and that's unheard of these days. And even back then, they normally do them themselves. So he sent me to a neurosurgeon. We did all the CT scans from brain all the way down. Prior to doing it, I remember the neurosurgeon saying, Traci, I never see anybody with a perfect spine, and you've got one. I wish we didn't have to do this. I signed off because of the paddle to do a partial laminectomy. When I went back and got my medical records, they did a full laminectomy in more than one area without letting me know. And if I wouldn't have pulled medical records, I wouldn't have known. So instead of taking a piece of the vertebrae out to allow the leads and the wires to go in, they removed a whole section. And that was something I was just never told. So the first one was Medtronic with a rechargeable battery. And the problem with me and my body, as you guys have all figured out by now, I don't respond to medications. So normally it's done on an outpatient basis. But because of what happened with my lumbar sympathetic blocks and all of the medications that I was on, they couldn't tell the insurance up front that they were keeping me inpatient. They had to play the insurance game. But my neurosurgeon just said, there's no way we're going to be able to control your pain after this. And they couldn't. So not only did they have to do it with a general, I ended up in the ICU for over 2 days, 2 or 3 days, because they couldn't control my pain. And that's unheard of. So then, finally getting home with a spinal cord stimulator. And every time I had to recharge the battery, my foot and ankle would swell 3 to 4 times its normal size. Wow. So I tell my doctor, I tell the Medtronic rep, I tell Medtronics, this is what's going on. And they all looked at me as if I had a third eye in the middle of my head, or that I was making this stuff up. And number one, a patient isn't going to know to make that up. Number two, why would we? We're just reporting what's happening to us. But I felt like I was on the defensive at that point because I felt like I had to prove what was going on. So we started taking pictures and videos and submitting pictures and videos, which as a patient, we should never have to do that. And that finally got their attention between the neurosurgeon, pain management, and also Medtronic. So then they said, well, let's take out the battery and put in a non-rechargeable battery. So there's an additional surgery. Keep in mind, with every single one of these surgeries, I asked my neurosurgeon and the anesthesiologist, do we need to take precautions? Is there anything I need to know about this? And they're like, no, CRPS never spreads because of spinal cord stimulators. Wrong. So when they switched out the rechargeable battery to a non-rechargeable battery, the whole system went haywire, and Medtronic made the mistake of trying to blame a neurosurgeon for it. And he had a huge ego. We could not do any MRIs because of that particular type of device way back when. But we could do ultrasounds and x-rays, and he proved that nothing moved, nothing migrated. But Medtronic, again, did not want to take responsibility because the system was going haywire to the point that I literally fell down my stairs at home twice. I was lucky I didn't break something or get hurt. And they couldn't tell us why it was going off by itself. Even if I had it on the lowest level or off, it would automatically come on. And it was horrible. So we finally took out Medtronic. Then they talked me into doing Boston Scientific because they kept telling me, Traci, there's nothing else we can do. Like, it's this or nothing. So between all of these surgeries, the CRPS that started my left foot and ankle had spread up my left leg. And with the third surgery with the Boston Scientific spinal cord stimulator, my CRPS spread into my hips, my back, and way up to my shoulder. So what started my foot and ankle is now in 80% of my body. In addition to that, I had chronic migraines, obviously insomnia, which every CRPS patient has, or 99% of them. And it was just, I could not wear a sock on my left foot or ankle. The Casalgia allodynia never went away. I could not walk. I was either always on crutches, or if I had a good day, I'd walk with a cane. So it was not a good situation. The Boston Scientific spinal cord stimulator, within a matter of weeks, we noticed that we couldn't program it or wouldn't hold a program. And the rep kept saying, we've never seen this before. We've never seen this before. So again, neurosurgeon back involved, and he did ultrasound, x-rays, and ultrasound was showing scar tissue, not just around the spinal cord stimulator, but a buildup of scar tissue on the dura of the spine. So he quickly did research, not through the DME companies. He was looking for case studies on neurosurgeon sites, and he contacted me in less than 24 hours, and that is not good. And he's like, hey, Traci, I found a couple case studies that are showing that there are other CRPS patients that have had spinal cord stimulators. They had to build up a scar tissue on the dura, and they ended up paralyzed. And I said, you're telling me I'm going to be paralyzed and have CRPS? He's like, it's a possibility. So as quick as we could schedule the surgery to remove the last spinal cord stimulator we did, it was a very, very long, tedious surgery because there was so much scar tissue in there. And again, that equated to not just an outpatient surgery, that again was inpatient, ICU, pain control, and then being discharged again. And at that point, after that surgery, my entire medical team in Southern California said, there's nothing more we can do for you. We've done everything in our power. We will do the best we can to keep you on medications to try and keep you comfortable, but there's nothing else we can do. Yes, they were doing ketamine comas out of country. Yeah, I looked into it. I was desperate, but was I willing to risk that? I was a mom. My son was a teenager. I was raising my half sister who's 20 years younger than I am. I couldn't risk that. That wasn't a risk that I was willing to take. Calmer scrambler therapy was brand new. I talked to a practitioner about it, and they're like, we've only seen a few CRPS patients at this point. We know, they're getting some benefit, but we don't know to what extent because it was so long ago. And I had a friend of mine who was an anesthesiologist, and I talked to him about doing higher dose ketamine infusions, which they do now all the time. And his response to me, back then was, Traci, every drug has a side effect. He goes, as your friend and as someone who's been an anesthesiologist for 20 years, he goes, I wouldn't do it because we didn't have research back then as to what high dose ketamine over a long period of time would do or what were the side effects. So that's why I didn't go that route, because I know people on here with CRPS are going to go, well, why didn't you do high dose ketamine infusions, or why didn't you do Calmer scrambler therapy? Again, we're going back over a decade. And so a lot of this stuff either was new or didn't have research and stuff like that. So I had a family member who had gone to Germany for cancer treatment. And she is actually my former mother-in-law. She went over there for 3.5 weeks for cancer. And while she was over there was when they were pulling out my spinal cord stimulator. And she asked the medical director, she goes, have you guys ever heard of CRPS? We're desperate. And so back there in Germany, they call it Sudeck syndrome. So they started talking about it. And what I know now is they had never treated it, but they knew of it. So, but they didn't tell me that they had never treated it before. They made it sound like, yeah, they could help. So as soon as I was cleared post-operatively, that was my first trip to Germany because I really felt like there was nothing more for me to do here. So the last 2.5 years of my 7 years with what I'm going to call active CRPS, I literally was traveling the world. And that wasn't a good thing. Number one, it was time away from my family because I wasn't gone for a week at a time. I was gone for months at a time. And, trying to travel from Southern California to Frankfurt, Germany, and in between those trips down to Mexico. I mean, nonstop on Lufthansa, figured that one out really quickly from Orange County, or actually LAX to Frankfurt, was about 12 or 13 hours. But for CRPS, that's an eternity and it's so painful. But if they were going to give me hope, I was willing to do it. So the first trip to Germany, I did blood stem cells, knowing that my CRPS was type 2. That made total sense to me. So the blood stem cells alone were a quick $25,000. And I was willing to throw everything at that. I believed that blood stem cells would be the answer, knowing the damage that was done. And it didn't. They said it would take 6 months to see the full effect of the stem cells. And the only thing that I saw was the hair started regrowing on my left leg. And for anybody that has CRPS, they understand that's not a good thing. That meant I may have to shave it. So I was really happy when hair wasn't growing. It did not help with my pain levels. not even by 1 point. We also did a lot of treatments over in Germany and down in Mexico. Looking back, they were stupid. And that's the nicest thing I can say. And yeah, I'm saying it. But when we're desperate, we're willing to do anything. I keep in mind, I could not touch my foot or ankle. I could not put a sock on. But yet I allowed them to do something called neural therapy because they told me it would help. And that meant that they were injecting my foot and ankle and the scars on my back with procaine, a natural form of marcaine or lidocaine. And because my body doesn't respond, it did not numb the area. And then after that, they followed all of those injections. And we're not talking 1 or 2, we're talking sometimes 20 to 50. And they would follow that with injections of ozone. So their thought pattern was as if they could clear up the scar tissue, that it would help with the pain. And the problem is by the time we got going on that, they were literally throwing my body into shock. I mean, I would be ghost white, shaking, couldn't control my body temperature. And they'd literally wrap me up in warm blankets and say, lay down, we'll be back in a little bit, and just leave me. And my foot hurt so bad. In my book, there's actually a picture of a bloody foot. That was after after what they did. And, the next day they're like, we got to do it again. And I would say, no, I can't. And they would say, you don't have a choice. Well, what I know now is, of course I had a choice. But what I was afraid of as a patient is if I don't do it and they're telling me that this is going to help me, even though it was causing my pain levels, they were unfathomable. Because they told me it was going to help me, I was willing to do it. And I think that's what I hear from patients going to other clinics is, they're doing treatments that are causing enormous pain, but they're told if they don't do it, they're not going to heal. I'm telling you, that's wrong. So we did neurotherapy. We did a lot of blood ozone and ozone treatments. So ozone is an extra molecule of oxygen. So that kind of made sense. Hey, if we put more oxygen in the body, kind of like hyperbaric is going to help my body heal. Well, it didn't. We were flipping cancer protocols to pain protocols. I was literally a human guinea pig out country. And down in Mexico, I was stupid. We all are when our back is against the wall. And they wanted to flip a cancer protocol called IPT or insulin potentiated therapy into a pain protocol. And they convinced me it would help. So I'm like, if it's going to help, I'm down. I'm here already. Let's just do it. Well, the problem is my veins blow, they roll, and you can't keep an IV in. And I tried to tell them that. And they should have started 2 IVs, one as a backup, and they didn't. So essentially what they do is they administer a medication through IV that's intentionally meant to drop your glucose levels. And when they get really, really low and you're on the verge of a diabetic coma, what happens is your cell membrane thins out. So with a cancer patient, they can give a very small dosage of chemotherapy and it gets into the cells. For me, they thought, well, hey, if we can do that with a cancer patient, we'll do it with her, only with pain meds. And so they did it. They administered the medication to drop my glucose levels, and unfortunately, the IV blew. And it took them 20 minutes to get another IV started, and they could not stop the medication. So when I say they just about killed me, it is not figurative. It was very literal, and it took them over 6 hours to stabilize me and get me back from that. So I think, if nothing else, it just shows the extent that we're willing to go to as a patient. When someone says, this is going to help, we're willing to do it. And I think the biggest thing I want people to hear is you got to listen to your gut. The things that got me in trouble, from the spinal cord stimulator to neurotherapy to IPT, every single time I went against my gut instincts, and I didn't want to listen because I'm desperate. So in between those trips, I had a lot of friends and family looking for options for me. And again, you name it, I had done it by that point. And I had 2 different friends. Neither one of them knew each other. And they both said, hey, there's this guy that does, clinical hypnosis, neuroplasticity training, working with mind, body stuff. You got to go talk to him. And I'm like, no, not going to, no, that was not in my wheelhouse. Not going to do it. But after my last trip to Germany, I was desperate. I would, if you told me to go do something just idiotic, I was doing it. So I did have the conversation. And ultimately, what helped me get into remission is all the stuff that I did not believe in. And that's kind of the jumping off point of what we do now. So neuroplasticity, our brain's ability to rewire itself. Clinical hypnosis worked because, as a piece of the puzzle, our brain won't allow us to be in fight and flight and relaxed at the same time. So, and there's also a lot of research that I know now that I didn't know then that shows how clinical hypnosis can actually help because we're able to work with the brain. So, what I did for 5 days, which was getting out of fight or flight, working with the brain, working with heart rate variability, working with light sound therapy, which again works with your brain. Those were all the things that got me out of fight or flight. And ultimately, those were the things that got me into remission. And again, I cannot say enough. Those were the things I didn't believe in. My background was traditional medicine. My mother-in-law, ran a medical practice in traditional medicine. That's where our brain was back then. But I also knew it was alternative and holistic medicine that got her cancer free. And, now all of a sudden I'm doing something that I don't believe in, and it helped me get pain free. Did I think it was going to hold? No, I didn't, but it did. So, that's a very long story, but I think a lot of people can relate to that because, at this juncture, I've been treating CRPS and chronic pain patients and intractable pain patients for about a decade. And I've been in remission. This week is my anniversary week, my 11-year anniversary of being in long-term remission. So long-term remission, my definition is pain-free, 0 flares, 0 coloration changes, and being able to live my life and do the things that I want to do. And I need people to hear that, yeah, that's possible. I'm sitting in front of you. And it is possible. I hear people that do a lot of other treatments. And yeah, whether it's intractable pain, central sensitization, CRPS for kids, amplified muscular pain syndrome. When we look on the internet and we look at what they're doing, it's even some of the top universities from Mayo to Johns Hopkins to Cleveland Clinic, UCLA, Stanford, etc. They're all running the same programs with pain management, which is you have a psychologist telling you, you know what, when you learn that this is your new life, you're going to be able to move forward. So they're telling you this has to be your life. Well, that's when people are committing suicide.
Yeah. Yeah, I felt that way. My journey was not anywhere near as horrific as yours, but I spent 3.5 years in agonizing back pain, and nothing anybody did was any help. And I was told that I might have that for the rest of my life, and I was 28 years old, and I thought about killing myself.
Yeah, I think anybody that says that it doesn't cross their mind, they're lying. As a mom, it crossed my mind. I had the meds to do it. And they would have just looked at it very simply as an OD. I shouldn't admit that on a Facebook Live, but let's just be transparent with this. If it doesn't cross someone's mind, it doesn't mean that we're going to follow through with it. Okay. So don't get me wrong on that.
We're still here.
Yeah, exactly. So the reality is when we're dealing with pain this 24/7, whether it's chronic back pain or whether it's CRPS, and you're not sleeping. I was doing good to maybe get 2 hours of sleep at night, and that was not 2 hours straight. So the pain is causing stress and anxiety and possible depression and insomnia. And even for someone that doesn't have chronic pain and they're not sleeping, they're not thinking right. And then add in brain fog and all of the coexisting conditions that come with it. It's hell. And anybody that says it's not, they're lying. So I think a lot of people, whether it's kids that think that their life is over, whether it's adults that we're just trying to survive to that next day. Yeah. I mean, we're desperate and we're willing to do whatever it takes and go wherever we have to go. And the problem is a lot of people that have never lived with CRPS or never lived with chronic pain, I hate to put it this way, they're clueless. I mean, they're not teaching this.
They don't understand how bad it can be, and your story of, trying everything and being harmed by conventional medicine and having the mind body stuff be the last thing that you try. Not everybody gets to that, that place of trying mind body. But often it can end even decades of pain,
Yeah.
because pain is generated by the brain. The brain decides to send the pain signal.
And
And
I
you
think
have,
a lot of patients don't want to hear that, though, because they're so used to people not believing them, people looking at them. For the females, if they're older, they're told it's hormonal, that you're postmenopausal. For the kids, they're told you're too cute, you're too athletic, you're too pretty. For the guys, they're told you look like you're too athletic, you can't be in pain. So all of us are being told it's in our head. So when they hear what you're saying, which is the same thing that I talk to them about, which is our brain is in our head, our brain is the best supercomputer possible, then for some people, they look at that as, see, you don't believe me either. And I'm not saying that, neither are you.
well, and the thing is, all of those things that caused you harm, a mind body approach will not cause you harm.
Right.
It's it's definitely worth trying. And that's really what got me out of my pain. In my case, it was biofeedback. Um, at the time that I was just in agony and I've been told, just live with the rest of your life, a friend of mine gave me a book about the mind body connection, and it mentioned biofeedback. And it was about just learning to relax and get my body out of that fight or flight. And, if you weren't stressed when you started, after you've been in pain for a really long time and nothing is helping, you're going to be very stressed and traumatized by the treatments. And you've got to get that brain calmed down, because that's what, if it gets on that track and doesn't stop, that's what perpetuates the pain.
And that's exactly it. And I think one of the big things that I talk to everybody about, whether it's something like this, it's a Facebook Live, or whether it's consults or someone in my office, or even talking to other physicians about this, I think our system's broken right now, and it's been broken for a while. So we've now gotten to the point in our medical field where everybody has their specialty, everybody has their subspecialty, and nobody talks to anybody. So you go see your primary over here, your ortho over here, your rheumatologist over here, pain management, neurology, et cetera. The list goes on and on. Everybody has their piece. But then they see a complex diagnosis like CRPS, or for some vibro or central sensitization, again, all of it, intractable pain. And then they want to put everything into that box. Well, if we can get back to the basics and get back to treating the person as a whole, because just like you're talking about, Cindy, the reality is our brain runs our entire body, and our brain sends the signals to our autonomic system, and our body is meant to be balanced. I talk to everybody about that. So when we start looking at all the different components of CRPS and intractable pain, fight or flight, that sympathetic overload is a big, big piece. It's a driver, it's a mechanism. And the problem is pain causes stress, which causes anxiety, for a lot of people, depression. A lot of the stuff we go through, I had medical PTSD. Come on, let's be real. Most people do after they've gone through that. Plus, we've got insomnia. Some people call it pain insomnia, call it whatever you want. It's a huge ball of wax. And then on top of that, because of everything going on, even if people aren't over medicated like I was back then, then you have brain fog. Then you have your existing and coexisting diagnosis and conditions. And the problem is break it down very simply without a bunch of medical terms, your autonomic system automatically runs everything in your body you don't have to think about. So when that is here, it's not balanced, sympathetics in overdrive and your parasympathetics down in the ditch, then our brain can't and our body can't function. So the longer we're in that state of that sympathetic overload, then that all of a sudden is when these other dominoes can start triggering. And so that's where I hear a lot of people say, hey, my eyesight's getting worse. I'm having GI issues. I'm having gut issues. I now have gastroparesis. I'm having heart palpitations. I'm having bladder issues. And the list goes on and on. Well, let's get back to basics.
Mm-hmm.
Let's get
Mhm.
back to human anatomy, the biology and the physiology, and start treating people physically, mentally, and emotionally. And
Mhm.
that is what's making the biggest difference. Because for someone like me, mine was type 2 CRPS. So what that means is we know that there was nerve damage. So anybody that ends up with CRPS following a surgery, they're going to say it's type 2. Type 1 CRPS, there's no known nerve damage. So, for example, I had a 9-year-old 4 years ago who ended up with CRPS after some mosquito bites, believe it or not. I've had a lady out of the Midwest who ended up with CRPS following a bee sting. She grew up on a farm. She'd had a million bee stings over her life. So the problem is whether it's CRPS or intractable pain, especially with CRPS, there's not enough information. There's definitely not enough studies going on, and there's not enough information for us to disseminate or go through to figure out why person one has CRPS and person two with the exact same set of circumstances does not. And for me, I think the big thing that I talk to people about all the time is a perfect storm in the brain. So there's a drop in the immune system, there's an incident, an injury, something that's going on, and there's a lot of stress around that time. And that can create this perfect storm in the brain. So I think in this day and age, so many people are familiar with the internet and social media that what I tell them is if we're out searching for something on our computer and then you go back to your computer the next day and it's got a glitch, it's got malware in there. So with CRPS, it's kind of like malware in the brain where all of a sudden the limbic system is sending out the wrong message, and that's affecting our autonomic system. Everything is automatically supposed to happen. And then we have that dysregulation. So dysautonomia, dysfunction in your autonomic system. And, and then it goes again back into the brain, limbic system dysfunction, because we're sending out the wrong message. And then all of a sudden we've got pain levels. We've got vascular changes going on, vasomotor changes, where there's temperature changes, there's coloration changes, sensitivity to touch. And, that's where our approach is a whole body approach, physically, mentally, and emotionally. So we have an EMDR therapist, eye movement, desensitization, reprocessing to help take that emotional charge out of what people have gone through. Some people do have trauma going back to childhood or former marriages or, stuff that may have happened. But then I see some kids, I've seen kids as young as 7 years old. There's no trauma back there, but all the stuff they've been through has been traumatic. So
Well, there's also epigenetics, which says that you can have trauma from generations back in your nervous system, that it gets programmed into your DNA. So, even with no trauma in your lifetime, you can still have trauma in your nervous system.
Yeah. And I've heard about that, so I just kind of we've got to look at all of these pieces. And, I put EMDR in place about 3.5 years ago, just short of 4 years ago. And part of the reason why I put that in place is that people were doing really well in the program. If they had an issue down the road and there wasn't a re-injury or something else that culminated, it tied back. It was a tie. So with EMDR, if we can take that emotional charge out of what patients are going through, then all of a sudden we're looking at a long-term outcome. And that's a really big thing. Yes, for those people that are open to it, I am the person who is credentialed in clinical hypnosis, and there is a ton of research behind clinical hypnosis. It's not a pocket watch. It is not mind control. There's all these misconceptions. I can't make you quack like a duck or bark like a dog, nor would I. And for me personally, because I've lived with CRPS, I also don't believe in making people relive it. So, we can use this as one as a way of getting out of fight or flight, but number two, tie in neuroplasticity. So really easy, our brain's ability to rewire itself, because our brain is always changing and adapting and rewiring. So I think one of the best analogies that I can give people or a metaphor is a filing cabinet drawer. The older we are and the more life experiences we have, the longer our filing cabinet drawer is, because everything that we learn in life We learn through repetition. Reading, writing, driving, using a smartphone, riding a bike, anything sports, we all learn it through repetition. The problem is in the same way our brain can learn how to ride a bike or how to drive a car, how to use a computer, it can also learn chronic pain. And when we're dealing with that day in and day out, all of a sudden it's the very first folder in our filing cabinet drawer. So in split seconds or nanoseconds, when we go to do something, our brain goes off of our past events. So what does it feel like? How do I act? How do I react? And what do I respond? And if it gets to the same folder every single time, you don't have to have a medical background to realize your brain is going to respond the same way every single time. You've got the loop going on. So with neuroplasticity, it gives us the ability, especially with clinical hypnosis, to go back prior to CRPS or prior to chronic pain or intractable pain and use those positive folders. Because every single time we visualize, every time we get into those folders, just like a search on a computer, your brain has to pull that folder to the front. And when we can start doing that, we can start moving the pain folder back while we're making new memories and essentially stacking the deck. And then eventually being able to get that chronic pain folder to the back of the filing cabinet where it's a dead folder. We can't delete a folder out of the brain. Our brain will not allow us to do that. Everybody's like, just delete it, Traci. We can't. We can't. I wish we could. Yeah. So, when we start talking about the brain and the autonomic and neuroplasticity, it makes a big difference. We do work with the vagus nerve. That is your 10th cranial, and it ties into your parasympathetic side. So when we talk about balancing the autonomic system, when we can tap into the parasympathetic, it makes it easier to balance out the autonomic system.
And that's the relaxation response, as opposed to fight or flight, which is sympathetic.
Yeah. And that's, and this is again where when we've got knowledge about the human body and how the body works and how it responds and getting back to the basics, that's where people are seeing the biggest difference. We do have modalities or treatments in place that we can promote healing. We can decrease inflammation. I can break up scar tissue non-invasively. That's all through laser. We work with PEMF, pulse electromagnetic frequency, and that helps with decreasing inflammation and promoting healing, even down to the cellular level. So there's a lot of different pieces.
I think when people think of lasers, they think of surgical lasers. Mm-hmm. Clarify that you're talking about what's called low-level laser.
Yeah. So there's different classifications. So the laser that we use is actually out of Europe, and it's a class 3B. So part of the reason why I chose the laser that we have is I know what it's like to have CRPS, and I know how sensitive we are and how much pain that we're in. So a lot of companies, other clinics, chiropractors, physical therapists that have different lasers, class 3 or class 4, they have an on and off switch. Well, the problem is when we have CRPS or chronic pain or neuropathic pain, our nerves are already overstimulated. They're already overly sensitized. So now all of a sudden we're sending energy in there. Well, if we don't have the ability to adjust the energy level or duration or the length of time we leave it on, that's when people end up in a flare. So that's part of the reason why I chose the machine that we use is number one, they've got amazing research behind it. And number two, I have the ability, and one individual we had in office today was a perfect example. We started where we normally do. We always ask, hey, if you're feeling anything, any staticky sensation, anything outside of your norm, we need to hear about it. And she did. So we immediately stopped. We turned down the power level. We changed some different settings on there and then went back to it, and she was fine. And that's where that gives me and our staff the ability to make the adaptions, because I can't preach it enough. We're all as individualized as our fingerprint. So if you go and do a treatment that it's a rubber stamp, it's going to work for a couple people, but the majority of people it's not going to work for. So when we can take the modalities or the treatments that we have available and we can individualize it, or do more with one thing and less for another thing. Or there are times that I take something out of the mix for a couple of days so we can calm everything down, and then I'll put it back into the mix. That's what it should be about, is looking at the individual that we're working with instead of saying, nope, this is our program, this is our protocol, we're not going to change it. Well, that doesn't help. You know, and I think
really
that's
how we were harmed, with a lot of that stuff, as they just insisted, even though it was causing you more pain, that it was the right thing to do, rather than taking your feedback and backing off.
And the problem is there are other clinics right now in the United States that I see their patients and I hear the stories that, they're doing different types of treatments, and they're telling the person that they're working with, hey, I can't do this. My pain levels are too high. Like, I feel like I'm going to pass out. I feel like my finger's in a light socket and I'm being electrocuted. They're told to suck it up. They're told that they need to put more effort in, that they have to work through the pain and allow them to create more pain for them to heal. That's wrong. That is wrong in every sense of the word. And I will be the first one to admit it, because I allowed it to be happen to myself. And I think, again, when we get desperate and someone says, you either do this or you don't get better, we look at our healthcare professionals, we look at our medical team, and I don't care if it's a therapist, if it's a physician, I don't care who it is. We look at them as the experts. Yeah. And we're looking at them for the answers. So when they tell us, you have to do this or you're not going to get better, and we go against our gut instincts, that's when chaos can happen. And that's where people need to realize, and I didn't realize it either. I know so much more today than I did back then. There is something called a patient bill of rights. And we also, as an individual, have a right to say yes to something, and we have a right to say no to something. We have a right to ask questions. We have a right to know outcomes. We have a right to do our homework. And, that's what I tell people is, do your homework. Listen to your gut, talk to people, and figure out what's right for you. And that's what's going to help you move forward.
Yeah. So talk a little bit about the structure of your program. And I know it's intensive and it's in Boise, Idaho, and not everybody could go there and do that. But I think there are, some people may be able to, and that would be wonderful. But if they can't, just what are parts of your program that, maybe they could put something together, nearer to home or whatever.
Yeah.
Talk about the components a little more.
Absolutely.
The structure of the program itself.
Yeah. So the program has evolved over the years. So, if there are people listening to this either live or on a recording down the road, if someone saw me 6 years ago, the program has changed. And what I've told everybody from the very beginning is I'm on a bandwagon to find a cure. And I hope and pray it happens in my lifetime. We'll find out. But because of that, that's where our program has evolved and has changed over the years. So our program is now a 2-week outpatient program. And people hear that after talking to other clinics where they're there for 3, 4, 5, 6 months. And they're like, 2 weeks? Yeah, right. Well, the big difference is this, is number one, you're being put into a healing environment. Our office is anything but clinical. Number two, we listen to you. Number three, you're with me 5 hours a day, Monday through Friday for 2 weeks. And it is not sitting in a waiting room. Everybody's given a private room, so they feel like they have a home base. They feel like they're being cared for and they're taken care of. That alone brings their stress levels down. We're not going to tell a patient, which other programs do, that you're waiting in the waiting room as part of your treatment. No, it's not. There are days that we may do 5 treatments. There are other days we may do 8 to 9 different treatments in one day. So as I mentioned earlier, we have an EMDR therapist who's credentialed, licensed, and has a slew of CEUs behind her and everything else, licensed in Idaho and the state of Washington. So she's on staff. We work with a class 3B laser. We work with vagus nerve. We work with PEMF, clinical hypnosis for those people that are open to it. If they're not open to it, I'm not going to force it. I've got workarounds. We work with neuroplasticity. We do work with biofeedback, heart rate variability. And we've introduced other things such as peptides into the program that'll decrease inflammation systemically and promote healing. There's all these different moving pieces that are there in the program. And when people come in, again, they're with us Monday through Friday for 2 weeks, approximately 5 hours a day. Yes, we are in Boise, Idaho. And yes, we actually see people from around the world. We see people from all over the US. Right now in office, we have someone in the area from New York. Next week, we've got 2 other people, one coming in from the East Coast, somebody else coming in from the Midwest. We see some people locally, and we've had people fly in from out of country, from Denmark, Costa Rica, Mexico, Canada, Australia, New Zealand, etc. So, I think the big thing is, for us, my philosophy is we don't have to cause pain to heal. And as someone that's lived with CRPS, when people come in, it's like a fresh breath of air for them to be able to talk and work with somebody that really understands it. And, I can walk them through things and their family through things that nobody else can. With that, we're also sending them home with 3 devices, and we send them home with a 90-day home program. So if somebody needs to go out further than 90 days, done. If I could do this for free, I would. We can't. That's the reality of it. We also have a nonprofit. So the IRS granted us a nonprofit status. So we do have a foundation. And our goal in the next 6 months to a year is to be able to raise enough money to offer partial grants and scholarships. We are not there yet. We're working on it. Also to be able to do community outreach, not just in Idaho, but across the United States. Ideal goal is to be able to canvass every major city in every state nationwide, and not just do outreach to patients, but also to healthcare providers, because knowledge is power. And the only way that we're going to make a bigger difference is by educating our healthcare providers. And
I'm working on that myself. I'm working on creating a course for healthcare providers. So you've talked a lot about CRPS. What other conditions do you treat at your clinic?
Well, a lot of the patients, because of my background with CRPS, do have CRPS. But we'll treat central sensitization syndrome for kids typically that are 18 and under, some that are 21 and under. They're being diagnosed with something called AMPS, Amplified Muscular Pain Syndrome. You look it up and they're going to reference CRPS. I have had one quadriplegic that a year after his spinal cord injury, he all of a sudden started having phantom limb pain, and nobody could figure out, and all they wanted to do was put him on gabapentin. We've treated a lot of fibro. I've had people in office that have had back surgery, neuropathic pain, small fiber neuropathy, prudental neuralgia. So a lot of it is nerve driven, but for our intensives, again, we're doing 3 to 4 months of work in a very short window of time. And that's giving people a great foundation that we can then build up and out on when they get home.
Well, that sounds great. So maybe we could open it up to questions. If people want to put questions in the chat, we'll give people a couple of minutes to see if they want to do that. So you had mentioned to me that you are trained as an MD, but you haven't kept your license because of your experience. Could you speak to that?
Absolutely. So graduated from UCI decades ago, and very traditional.
People don't know what UCI is.
University of California, Irvine. So it's a medical school in Southern California. So, that's why the first 4 years of my treatment were all traditional medicine. Number one, nobody talked about holistic or integrative medicine back then. Number two, I didn't believe in it. So, I think when people have their own experience, regardless of what the diagnosis is, whether it's intractable pain, CRPS, cancer, then all of a sudden it opens us up to what other treatments that are out there. So all the treatments that we do in office now are falling under holistic and integrative. We do have licensed staff in office, but no, I am not board certified, nor is it required. I cannot re-diagnose someone. I cannot prescribe, and I cannot inject. Now, if somebody comes in and they've got a diagnosis, but we feel like there are other things going on, can we help guide them and work with their attending physicians back home? Absolutely. And I do that all the time. So I really believe in working together as a team. And people that have gone through our program, even when they get home, if their attending physicians or prescribing physicians want to speak to me, even their PT or OT, I will do any consult call and never charge for it, because when we can come together as a team, that's what's really going to help them move forward.
So we do have a couple of questions. One is, how do we go about getting your services? So maybe you can mention
Absolutely.
your website.
So the company is Holistic Center Treatment, and we've got social media all over the place. Our website is www.holisticcentertreatment.com. We've got Facebook, we have Instagram, TikTok. You can go to our website. We never charge for a consult. Again, knowledge is power. And if someone decides to come see us, fantastic. We welcome you with open arms. And if someone talks to us and they believe that the only thing that's going to help them to get better is a pill, a procedure, or surgery, honestly, we're probably not the right program for them. So yeah, you can just visit our website at holisticcentertreatment.com. You can call us at 844-994-0999. And, we can set up a free consult via telephone, Zoom, FaceTime. We're very flexible with that.
Okay. I'm going to put the website, I'm going to get my keyboard here and put the website in the chat.
Yeah, I see somebody did ask about insurance, and I think the comment is, do you have any luck with insurance covering it? No. Meaning they're not going to cover it up front. Do we provide a full super bill to individuals afterwards? Yes. Have we had individuals get partial reimbursement? Yes. If somebody has a health savings account, a flexible spending account where they're putting pre-tax dollars in, our program does meet all of the IRS guidelines, and we have had people use their FAFSA or health savings accounts to cover it. But at this point in time, because it's non-invasive and drug-free, we follow our patients. We can give outcomes. We can give case studies. When people come in on day one, we have them rate their pain, their quality of life, their sleep. When they finish, we're re-rating that at 30 days, 60 days, 90 days, 6 months, 1 year, and annually after that. We are having them complete the same information. And that's how we can give outcomes, statistics, and again, case studies. So that information is all available, and it's actually, I think, on our nonprofit side.
What is your nonprofit site?
The nonprofit is hct.foundation. So yeah, it's hct.foundation. So that's the nonprofit. They can also get there through our normal website at holisticcentertreatment.com. At the top on the contact bar, there is actually a link for our foundation on there. So that can help direct people too.
Oh, okay. Well, that sounds really good. I'm looking to see if anybody else has any questions. We'll give them a couple of minutes.
Yeah. And I know somebody had made a comment, at the very beginning of it, of what's the point of the presentation? And I see the comment up there, but I think the big thing is, to answer that question for them is chronic pain patients need to know that there's someone out there that's treating them that's actually been through the whole thing. And I think that's a really valuable point, because even with myself, whether we're going to pain management, primary care, a neurologist, or a neurosurgeon, most of them have absolutely no idea what we're talking about. We're trying to explain to them what is CRPS, and we're trying to educate them, and they don't understand. So, I think to answer, the question of after 40 minutes, what is the point of this? I think the first part is Cindy asked me to do, was to basically give you guys some groundwork to let you know that, hey, been there, done that, got the t-shirt in a nice way. and
Well,
then afterwards to talk about potential treatment options that are actually helping. So hopefully you were able to gather that information as the presentation went on.
yeah, I mean, the reason that I asked Dr. Patterson to be very detailed is to let people know that even after all of that, she was able to get well. I wanted people to know that wherever they are, there is hope for them. It's about finding the right thing for you. And so often, if you go to my website, paintreatmentdirectory.com, and look at the inspiring stories, you will see Dr. Patterson's story, and you will see some other ones where people went through sometimes decades of pain and nothing helped until they addressed the mind body stuff.
Yeah, and I know there's a mom earlier in the presentation that asked a question of, how did I afford this? That it's devastated them. I understand that. I mean, the reality is less than a year in, I had to resign from my position, and we were in Southern California. We were relying on two incomes. We were a dual income family. So not to have that income, not to be able to do that. The reality is yeah, I spent in excess of $250,000 to get my life back, and it was not in my bank account. And, and nobody should have to do that. And that's part of the reason why I do what I do. And that was the other big push for me, and it's taken me years to do it, is to be able to start the nonprofit side of it so that we can eventually offer partial grants and scholarships. Because I've had too many people say, hey, Traci, it's a great program. You're making a huge difference. But what about for people that can't afford it? And that's where the nonprofit comes in. And that's where we can also partner with other nonprofits that can also help offset some of that cost. So it is a progression, and we're doing everything that we can.
In terms of insurance covering the cost, just one of those spinal cord stimulator surgeries is many times the cost of your program.
It is. My first one had in ICU for several days. That bill was in excess of $100,000. And,
Right.
We've gone, and again, we've got information on our nonprofit side. We've gone to the point of looking at and gathering statistics from Blue Cross Blue Shield, the VA, and also Kaiser Permanente, which happens to be one of the biggest HMOs. And we pulled statistics of what do they pay on an average year to treat CRPS and chronic pain. The second statistic was CRPS, spinal cord stimulator. And the third statistic was more relevant, which is CRPS, spinal cord stimulator, and complications, because that's where people end up. Our program is less than 10% of what they pay in 1 year, but yet we can't get them to cover it. So, that's where it's going to take advocacy, awareness, patients pushing their insurance companies. But in the meantime, again, that's where we've got, I love your cat. That's where we have to step in and do a little bit more as far as a nonprofit side to make this more accessible to people. And that's what we definitely are doing.
Yeah, I mean, I think it's great that you have a foundation to raise money, but ultimately, we do need to get insurance companies to pay for it. And we really need a federal law that says that insurance companies have to pay for proven treatments for chronic pain.
Yeah.
Right now, they'll only pay for pharmaceutical and surgical interventions. And that is just wrong. Not only is it wrong, but it costs everybody lots more money. This is why health insurance is so unaffordable. This is part of my pain treatment therapy here.
I love it. I absolutely love it. But I think, that's exactly it. I mean, our insurance companies, unfortunately, there's a big kinship there with the pharmaceutical companies. So, irregardless, when you start getting outside of the box is what I'll call it, and you start looking at other treatments that are not procedures and they're not surgeries and they're not medication, a lot of people, that's where they're finding their hope, and that's where they're getting some relief. And that's the biggest thing that we've got to do is, eventually make that big push to make a bigger difference with the insurance companies. But it's all a process. Knowledge is power. And when we can start making a difference within the medical programs and really allowing our physicians and all of our healthcare staff to start learning more about intractable pain and all of the different diagnoses, that's what's going to make a bigger difference. And, that's where we've got to have the push all the way around.
I do have an interesting side piece of information, which is that Kamala Harris's stepdaughter, Ella Emhoff, lives with chronic pain. She had I forget what the exact name of it is, but her tethered spinal cord, I think it's called. I guess it's a fairly rare condition, but her spinal cord was adhering to, I guess, the vertebrae or whatever, and was causing her to bend over. And she had surgery for that as a child, and she's lived with chronic pain ever since. And so Harris knows what it's like to have a family member who lives with severe chronic pain. And Ella is very into alternative medicine. So maybe there's an inroad there, assuming that Harris becomes our next president. I'm hoping. I've already tried reaching out to Ella Emhoff and haven't gotten a response yet, but.
Well, and I think, even when we look at, some of the people like Lady Gaga that's out there, who was very vocal about her journey with fibro and the things that she's doing. And there's other patients that are out there that have social media presence. So when we start looking at influencers, those are the people that are going to be able to bring more awareness and bring a bigger highlight into the things that are working and not working. But ultimately, the nice thing with being in the United States is we all have a choice as a patient as to whether we want to stick with traditional. But what I ask patients is, if you've been doing the same thing over and over, the definition of insanity is continuing that process. And trust me, I was guilty of it. But I think at some point, we really just have to look at when the things that we're doing are not working. At what point in time do we start looking outside the box? I was desperate after 7 years. Did I believe in the stuff that helped me get my life back? No. Am I the biggest believer in it now? Oh, heck yeah. Because it makes sense now.
I'm a believer. So someone is asking what the cost is of your 2-week program. And I just want to clarify, it's not only 2 weeks, but 90 days follow-up.
And we've followed patients for up to 6 months after the program without any additional cost. So the total cost of the program at this point in time is $12,000. And I know that that is steep. I know it's a financial impact, but I also know that there are other programs out there that, unfortunately, you just got off the phone with someone earlier this week that they spent 6 months at a program out of state, and not counting their housing, not counting food or transportation. They spent $75,000, and now they're looking at coming through our program. So, that's where I tell people, just do your homework. I don't care if it's my program, if it's Calmer Scrambler therapy, if it's ketamine, if it's another program, do your homework. Be willing to ask those hard questions. And if you can't get the answers, listen to your gut. And if someone tells you they've got a cure, especially for CRPS, run for the hills. It just doesn't exist. I think, a lot of places are doing a really good job, but nobody can guarantee remission. And that is the frustrating part.
Yeah. But you're doing pretty well at getting people in remission.
Yeah, we've got some amazing outcomes. And again, we can provide case study and outcomes. And we've got a lot of information that's over on our nonprofit side too.
And, it's a real pain in the butt, but it never hurts too much to ask your insurance company to pay. And maybe when your doctor says, let's go for a spinal cord stimulator, you can say, I'll do this instead. I'll pass up the spinal cord stimulator. I'll never ask for one. Send me this program instead. It's cheaper. I don't know if that'll work, but it's always worth a shot. And there's an article on my website about spinal cord stimulators that anyone who has been recommended to have one should read that article, because they're very high risk and they help very few people. So,
and that is true. And I think originally, A lot of the DME companies or durable medical equipment companies that are out there with spinal cord stimulators, they weren't really meant for neuropathic pain. I mean, they were originally putting them out there for failed back surgeries and things of that nature. But even with that, there are side effects, and they're not our doctors are talking to us about those as the gold standard. But the reality is it's never going to completely get rid of your pain. They're trying to override the pain signal. But as soon as you put a foreign object in the body, your body's going to safeguard itself and build up scar tissue, and that can cause other problems. So, Cindy does have a great article on it. There's also a lot of references out there if you step away from the DME companies and even do your own homework. But it's definitely, when it comes to a lot of intractable pain, it's really important to look at what makes sense. If you're already on medications, or people that have done spinal cord stimulators and done horribly with them, when your doctors start talking about a pain pump, you're still putting another foreign object in your body. And what are the mechanisms? Are you really going to get the benefit out of it? So these are the things that we have to look at.
Yeah. So someone is asking, insurance could pay for some components of your program, such as EMDR, hypnotherapy.
Yes.
That might depend on whether they have out-of-network coverage and whether you could break it down that way, I would think.
Well, when people finish, we give them a full super bill. So everything that the insurance company is used to seeing, from diagnostic codes to billable treatment codes, we give all of that information. And we have had individuals that have submitted it where they have gotten partial reimbursement. No one's gotten full reimbursement yet. And part of the reason that we run into that is, again, we're doing 2 to 3 months worth of work into 2 weeks. So we've had a couple of insurance companies, when patients submit their super bill, that have actually given us all leadway where we've been able to spread it out. Because even if somebody has mental health coverage, and that's where EMDR would fall, most insurance companies are only going to allow you to submit X amount of treatments in a 1-month period. Well, the way we have EMDR set up, it's self-informed. So it's the equivalent of doing 10 to 12 EMDR sessions in 4 days. And that's part of what we run into is I have hired billing specialists to come in to try and walk us through the hoops and loops and what else we can do. And we still have been up against a wall, but we do everything we can to provide super bills, documentation for anybody that's submitting to insurance.
Well, I know we've been on for about 90 minutes. So, and I'm not seeing any more questions, so we can wind up for now. But thank you so much for your time and for doing the work that you do.
Absolutely. It's my pleasure to be on here. Again, knowledge is power. And if there's any questions that come up afterwards, people can just reach out to us directly, and we will always answer questions.
And you can also look at my website. There's lots of information on lots of different kinds of treatment, including some of the things that Traci mentioned that are not mind-body, like the laser therapy, also known as light therapy, and the PEMF therapy. So I'll put the website up here. And Traci is, or Dr. Patterson, getting too informal here.
It's okay. It's okay.
She is listed as a provider on the directory. So you can look at her profile on there and connect with her through the Pain Treatment Directory website. So thank you all for coming and for sticking with us. And hopefully you've gotten some benefit out of it. So let me just send this out there into the ether. And, keep on looking for solutions. As Dr. Patterson said, trust your gut. If something has potential harm, really think twice about it. Really consider the mind-body approach. Yes, that too. Someone said vote blue. I think that we'll be in much better shape with a Harris administration. And there is an article on my website, if you haven't voted yet, that talks about the health policy positions of the 2 presidential candidates. I have a very strong opinion of my own, but what's on the website is what are they actually proposing. So, so good luck with that, everybody. And, there's hope for you. That's why I'm doing this. I want everybody to know, no matter how long you've been in pain or how bad it's been, there is hope. And Dr. Patterson has a very good program for that if you're able to access it. So thank you all, and good night.
Thank you.